Everyone, my name is Blair Davis. I am a social worker with Be More for Healthy Babies at Promise Heights, and welcome to the session of Prioritizing Parent Health. I'm so glad that you're here listening to this conversation, as I think it's so important. We often talk so much about the importance of kids getting adequate nutrition, of getting their appointments, of making sure that they're healthy and safe. And I love that conversation. I think it's so critical, but we also want to make sure that parents are taking time for themselves, that you're prioritizing your own well-being, your own health. I know you probably are familiar with the expressions about, you aren't able to pour from an empty cup, or the expression about making sure on an airplane that you put your own mask on before you try to put on somebody else's. I think that really applies here. When you're able to take care of your own health, to prioritize your own health, when you're able to manage, any conditions that you have, when you're able to ensure, healthy routines and, day-to-day health, you're better able to make sure that you can set up those systems for your children as well. So I'm really excited to be talking about this today, and hopefully you're able to take something from it. But the first thing that we want to talk about today is nutrition. So it's so important, as I mentioned before, we talk about children's nutrition, but it's so important that we focus on our adult nutrition as well, making sure that we're putting in all the things that our bodies need to function adequately and properly and at, peak health. So we want to spend a little bit of time just talking about a healthy eating plate. So this is kind of looking at your diet. And by diet, I don't mean something that's restrictive. I mean the way that you eat most of the time. And so if you can see on this graphic, it shows vegetables kind of being the largest portion on this plate. So in thinking about our overall diet, vegetables are really, really important. And they honestly should be a great bulk of what we are consuming, making sure that we're getting a large variety of different types of vegetables, different colored vegetables, getting your dark leafy greens and kale or spinach, making sure that you're getting things like tomatoes and cucumbers, just a wide variety of different vegetables to make sure that we're getting all these different nutrients, different vitamins, and things like that. So thinking about a colorful plate, and to keep thinking about that, talking about fruits, making sure that we're getting a wide variety of fruits as well. We'll make sure that we're getting different nutrients, vitamins, antioxidants, and all of those wonderful things. And both of those components, fruits and vegetables, are going to make sure that we have a fiber-rich diet, which is really important for our body functioning, for making sure that our body is able to absorb all the things that it needs to, making sure that our body is able to have a working and active digestive system. And that's going to really set you up for success in terms of energy and well-being. So moving forward, thinking about protein, healthy protein. So fish, poultry, beans, and nuts are really some great sources of protein. And then things like red meat and cheese, we want to be mindful about those things. So they're great for you. I would never say you have to cut them out. I think that they're awesome and tasty and can really be a great source of protein, but we just want to be mindful of how many days a week we're kind of enjoying red meat and cheese, just because it can have some consequences in terms of hypertension or in terms of cholesterol and things like that. So foods that says to avoid: bacon, cold cuts, other processed meats. I would say you can still enjoy these things, just being mindful of them. Once again, a lot of those foods actually are really high in sodium, and that can drive up blood pressure. And so it's just something you want to be aware of, be mindful of, and just be thinking about how often we're consuming these things. Whole grains, really important. So whole wheat, like whole wheat bread, whole grain pasta, brown rice. And then once again, you just want to be mindful of white rice and white bread and those kind of, refined grains or simple kind of carbs. We just want to be erring towards whole grain when we can, and just being mindful of refined grains. Making sure you're getting enough water in your diet is so important. Making sure that you're staying hydrated, drinking lots of water throughout the day, drinking like unsweetened tea, or tea with just a little bit of sugar, or same with coffee. And then you want to be mindful about milk and dairy and how much you're consuming that. So we say 1 to 2 servings per day. And then with juice, 1 small glass a day, and then avoiding sugary drinks where you can. And then healthy fats are so important. So it talks about healthy oils here, like olive and canola oil for cooking or on salad. And you want to be mindful about butter and avoid trans fats. But you also want to think about other healthy sources of fat. So that might be avocados, it might be nuts or seeds, or Greek yogurt, or things like that. That can be a really great source of healthy fat. And so we just want to think about making sure that we're getting a wide variety of food, making sure that where we can, we're eating, whole foods, and also on top of that, staying active at the same time. And so all of these work together to make sure that we are operating at our best capacity. And so we want to take a minute to talk about blood pressure. It's really important that we are being mindful about our blood pressure as we move throughout life. And so this is just a graphic. This is from the American Heart Association, and this graphic shows what is a normal or good blood pressure, and then when we want to start being a bit more mindful, and then when we might want to be a little concerned. So the green, you can see normal blood pressure is less than 120/80. I think they made some changes to that in the last few years, and so now normal is considered less than 120/80. At that point, you want to keep making healthy lifestyle choices, and you want to screen at least once a year, and that's just for anybody. And then for elevated blood pressure, if you start seeing 120/80, between that and 129/80, at that point, that's considered elevated blood pressure. You want to screen in 3 to 6 months, and you want to consider, maybe making some changes in terms of lifestyle choices. And so we'll get to what some of those are that might help to regulate blood pressure in a bit. Moving down to this red category, this is hypertension or high blood pressure. So stage 1, you're seeing numbers like 130/80, between that and 139/89. At that point, you want to see a doctor for follow-up and or treatment within 1 to 2 months. So you want to start thinking about making an appointment, getting in to see maybe your primary physician, or going to, whoever it is that you see, and just letting them know, hey, I took my blood pressure and I saw, it said 135/82 or something like that, whatever the blood pressure was. You might want to make record of it and bring it with you when you do see that doctor, hopefully within 1 to 2 months. At stage 2, you might see numbers at or higher than 140/90. At that point, you want to see a doctor for follow-up and treatment within 1 month. So at that point, you want to be picking up the phone pretty much right away and trying to get an appointment with your primary physician. The reason I say you might want to make that appointment right away is because, as you guys probably know, sometimes it can take a while to get in to see a primary. And so if you want to see them within the month, I would say right after you get that blood pressure, if you're at Save-A-Lot, or if you're at, a pharmacy and you happen to sit down and take your blood pressure and you see that number, get on the phone as soon as you can, because it might take a couple weeks for you to get in to see the doctor. Then moving on, if you start seeing numbers like 140/90 to 179/109, at that point, you want to seek medical attention that day. So you want to be going to urgent care that day and letting them know, I saw a number that looked like 152/104 or whatever the number actually was, and you want to let them know what you saw. At that point, you are at you're on watch for things like stroke, like heart attack. And so that's why you want to make sure that you are seeking medical attention that day. And then if you see a number at or higher than 180/110, and if you start feeling symptoms, at that point, you might get a headache, you might feel dizzy, you might have blurred vision, and you want to be going to the ER immediately, because you are, like I said, on watch for, a heart attack or stroke or, a hypertensive event. So at that point, you want to definitely be going to the emergency room. So let's circle back to those lifestyle choices that they kind of talk about that can help you to manage your blood pressure. If you start seeing elevated numbers, if you start, if you're in stage 1 or stage 2, you want to increase physical activity. So thinking about 30 minutes most days of the week. And so physical activity might mean going for a walk. It might mean doing some dancing. It might mean doing yoga or whatever it is, but going to the gym, whatever it looks like for you, whatever you enjoy doing, but doing it for 30 minutes a day, most days of the week. You might consider losing weight if you are overweight. I mean, not everybody who has high blood pressure is overweight, but if you are, that might be something that might help you to manage your blood pressure. Limiting salt, like I talked about a little bit, salt can drive blood pressure pretty significantly. And so it's something that you really want to be watching if you have elevated or high blood pressure. And that's all types of salt. So even if you're thinking, oh, but this is Himalayan sea salt, it doesn't matter. All types of salt you want to be mindful of at this point. You want to limit your fast food and processed foods. Those are high in fat, high in salt. And so you want to be really mindful of those. Limit fried, greasy, and fatty foods. Limit alcohol use. Keep up with your blood pressure numbers. So that might mean buying a blood pressure cuff, or it might mean every time you go into Save-A-Lot or go into CVS or go into Royal, or any of those places that you're taking your blood pressure and then reporting it. Working with a healthcare team. So working with your doctor, working with, nurses or whoever to manage your high blood pressure. Taking your blood pressure medication as directed by your doctor. So if they say you're taking it every day, you want to make sure you're taking it every day. If they say you're taking it twice a day, you want to make sure that you're keeping on top of it. And that might mean, setting an alarm on your phone to make sure that you're taking it, at a certain time. That might mean using a pill case. I'm a very forgetful person. So sometimes with my, if I'm taking medications, I'm like, did I take that today? Was that yesterday? And it's hard for me to keep track sometimes because I can be kind of forgetful. So for me, a pill case is really beneficial because then I know, nope, I took my pills today. Today is, Wednesday, I took them. So whatever that looks like for you, writing it down in a journal or writing it down in a planner, just finding a system that works for you. And then, working with a care team. So the Salty 6 is something that we talk about a lot. It's really important because of the fact that, as I said, sodium is a really important driver of blood pressure. And salt is really sneaky and it hides in a lot of things that we maybe wouldn't necessarily associate with salt. So thinking about bread and rolls, for example, this first one, that's something that I personally wouldn't think about necessarily if somebody says to watch your salt, but there can be a lot of salt in packaged bread. So, when you're going to the store, when you're looking for bread, looking at the sodium content on the bread can be really beneficial, and trying to find one that's lower in sodium, or making your own bread if you like to do that. But I know not everybody does. Cold cuts and cured meats. So you want to be really mindful about these. They can have a lot of sodium in them. You can look for options that are lower sodium varieties of them, but you just want to be mindful of them. When they say cured meats, those meats are cured with salt. That's how they, they're used as a preservative to make them last, to make them tasty, all these things. And so it can be really high in salt. Sandwiches, for obvious reasons, as I mentioned, bread and, cold cuts, cured meats, all those things, cheese, those things can have a lot of salt. So just wanting to be mindful of those. So it's not to say you can't have a sandwich. Of course you can, but just thinking about how to balance that out, thinking about, maybe having half a sandwich and half a salad or half of something else, or however it works for you, but just trying to be mindful and trying to be just aware of the amount of sodium that might be in some of the meals that we have. Same for pizza, buying pizza, especially if you're, ordering out or whatever, it can have a lot of salt in the dough. It has salt in the cheese. It has salt in the sauce. And so it can really add up to be a lot of sodium. And so, if you're having pizza for dinner, maybe consider having, a slice or two and then supplementing with vegetables instead of having, extra slices of pizza. You can also try making your own pizza. I love making pizza. It's one of my favorite activities to do with my friends or whoever. And then that way you can control how much salt is going into the dough, how much salt you're putting into your sauce, things like that. Canned soup. so random. It feels like something that you wouldn't think would have a lot of sodium, but it actually really does. That's how they preserve it. That's how it lasts for so long, is it actually has a lot of salt in it, and also, for taste and things like that. So just thinking about looking for lower sodium varieties, or making your own soup, or however you can. And then chicken and poultry, depending on how it's prepared, sometimes it can have a lot of salt. So it's just something that you want to be mindful of, and be looking at the sodium content on your food. So according to the American Heart Association, you want to aim to eat less than 1,500 milligrams of sodium per day. And so when you're looking at packaged foods, you want to be looking at the sodium content, and kind of looking at, you can sometimes look at the percentage and try to aim for foods that are, like 6 or 7% or less. And things over that, you might be like, well, maybe, and just being mindful of that. And so then, of course, I want to spend some time just talking about smoking. I know this might not be relevant to everybody, but for those who it is relevant for, I just want to offer some tips, some solutions, some support around this, as I know it is something that does affect a lot of people. As I mentioned, I'm with Be More for Healthy Babies, and so we talk about a lot the effect that smoking can have on, the children in the household, in terms of asthma, in terms of it can contribute to sleep-related deaths for infants, and sudden infant death syndrome. But just thinking about the adult person, thinking about the effect that it can have on your body as well, it's pretty great. And so, I'll go into it a little bit, but I just wanted to offer some support for anybody who might need it. So one of the reasons why we talk a lot about smoking, I mentioned that it can contribute to high blood pressure. Folks also know that it can contribute to different cancers of the mouth, throat, esophagus, bladder, kidney, pancreas, like all these different things, right? And, it can increase your risk for heart attack, for stroke, for coronary diseases, things like that. And so there are immediate benefits to quitting smoking. And so I just wanted to highlight some of those. So within 20 minutes after you smoke your last cigarette, your body already starts to make some positive changes that continue on for years. So even if you've smoked for a long time, it is not too late to start to protect your health by quitting. So 20 minutes after your last cigarette, your heart rate starts to drop to a normal level. After 12 hours of quitting, your carbon monoxide levels in your blood drops to normal. 2 weeks to 3 months after quitting, your heart attack risk begins to drop. Your lung function starts to improve. 1 to 9 months after quitting, your coughing and shortness of breath decrease. 1 year after, your risk of coronary heart disease is half of that of smokers, active smokers. 5 to 10 years after quitting, your stroke risk is reduced to that of a non-smoker. 10 years after you quit, your lung cancer death rate is about half that of an active smoker. And your risk of cancers, like I said, of mouth, throat, esophagus, bladder, kidney, and pancreas decreases. And after 15 years, your risk of coronary heart disease is back to that of a non-smoker. So there are immediate benefits and there are long-term benefits. And so we just want to highlight that and just offer any support to anybody who might need it by offering up the Maryland Quit Line. If anybody is familiar with it, it's a really awesome resource, and they will help you. They'll get you a coach. They can help get different, patches or gums or, different strategies to really tailor it to you, to find a solution, to find ways to kind of manage your stress that might help you quit and, maintain that long term. And so I definitely recommend that to anybody who is thinking about quitting smoking. They have some really wonderful resources and some really individualized resources that can help you be successful in quitting smoking. And like I said, it has really, short-term and long-term benefits to your health. So just definitely want to recommend that. Again, it's 1-800-QUIT-NOW, and that's the Maryland Department of Health's Quit Line. You can also go to smokingstopshere.com. So I also want to take some time to talk about the importance of keeping your appointments. So that's your medical appointments, that's your mental health appointments, whatever it may be. So we talk to a lot of families at BHB who tell us that, yeah, I haven't been to the doctor in a couple of years, I haven't been to the doctor in a few years, but my kids I make sure they get to all their appointments. I make sure they're caught up on shots and physicals and all these things. And while it's so wonderful to hear that, the kids are being taken care of and are making all their medical appointments, are being prioritized like that, that's awesome. But we also just know that it's so, so important for parents to make the same time for themselves, for parents to make and keep their medical appointments for their own health. When first of all, just going to your appointments regularly gives you some peace of mind, right? But outside of that, if there is something going on, you're able to catch it earlier. You're able to maybe get treatment for something earlier before it becomes a problem that affects your day-to-day functioning, and therefore then does affect your kids, right? If you're able to keep up with your appointments for chronic health conditions, for example, it's more likely that you'll be able to maintain kind of more regular functioning, and it'll be less disruptive to your day-to-day life. So we definitely just want to recommend that, this might be the reminder that you need right now to reach out and make your physical appointment for the year, to make sure that you're getting your dental cleaning every 6 months, to make sure that you're going to get your well woman visit or get a colonoscopy or whatever it is. Maybe you've been putting it off, maybe you've forgotten, whatever. I hope this is, kind of your gentle reminder to make that appointment today and to keep it and to, just prioritize your health and your well-being. And that same goes for your mental and emotional well-being as well. If you were thinking about reaching out about, therapy or mental health services, make that appointment today and keep that appointment and show up. And, I think that we're all better off for it when we prioritize ourselves in that way and make that time for ourselves and commit to that time. So once you've done that, this is just a list of to-dos before you go to your doctor's visit. So say that you have an appointment tomorrow and you're trying to figure out, what do I need to do to prepare? This can be helpful. So this is from Penn Medicine. So the first thing is to make a list of current medications and don't forget dosages. So go look at the pill bottle, go look at, if you have printouts or whatever you have, and write them all down. You can put them in a list on your phone, or you can take pictures of the pill bottles or whatever it is you need to do, but writing down the name of the medication and the dose of medication. And take this to every doctor's appointment. So, your primary care physician might have prescribed one thing, and then you go to your gynecologist. Take that list of medication to all of the doctors so they can know, oh, well, this other doctor prescribed you this thing. I wanted to prescribe you this things, but maybe those things might interact poorly. So everyone knows what's going on with your health, and they can tailor it really specifically to you, and the others, they can work together better that way. Being aware of allergies or sensitivities to medication. If you're allergic to amoxicillin, if you're allergic to ibuprofen, if you're whatever it is, just making sure that you keep that on record. You can just keep it in your phone or whatever. Sometimes it's hard to remember like the medical names for all these different, medicines that you might have a sensitivity to or be allergic to. Writing it down, putting it in your phone can be really helpful, especially if you're seeing a new doctor for the first time. Knowing your family history as best as you can. It's not always possible to know everything about your family medical history, but finding out what you can and writing that down might be beneficial for a new doctor to know. Bringing a detailed record of your medical history. If you're seeing a new doctor, you might want to call up your old doctor and say, hey, I'm going to see somebody new. Can I get a copy of my records, or can you fax them over to this provider? Just so everybody knows what things have occurred in the past or about your medical history, so they're better able to help you moving forward. Writing down any questions you have. This is a big one. So you go through your day-to-day life, and a lot of times we think about these things, oh, I noticed this ache or this pain, or, oh, I noticed this happen. I get a headache when the sun comes out, or whatever it might be. As you're going through life, you want to jot those things down. You can keep it in that same note in your phone. So that way, when you go to the doctor, sometimes you get there to the doctor's appointment and suddenly every question that you had, every concern you had just flies out of your brain. And that's really normal. That happens to a lot of us. And so writing those things down, so then when you're there, you can just whip out your pad of paper or your note on your phone, and you have those questions that you've been thinking about between the last appointment and this one. And then lastly, for some appointments, you might want to bring a friend or a family member, depending on, what the appointment is or how comfortable you are. But if it's an appointment that is overwhelming or scary or you're nervous about, sometimes it can be helpful to have somebody else there as an additional set of ears. So if you walk out and you can't remember, what the doctor said, somebody else has heard it, or, to help you formulate questions in the moment, because sometimes it can be really emotional. So having somebody there to support you can be beneficial. So these are just some ideas, but definitely having open and honest communication with your provider is really, really important. And finding a provider that you feel comfortable doing that with is really important. And so that, if you don't feel comfortable doing those things with your provider, you've tried and it didn't work, or you don't have the relationship that you want, it's okay to try a new provider and to find somebody else who you think might work better with you or for you, and who you might have a better relationship with and feel more comfortable to ask questions to, or to call up and, express concerns, or who you feel might listen to you more deeply and really hear your concerns. Those are all really and totally valid reasons to try to find a new provider. And so if that is something you've been thinking about, I do recommend it. And so if you're looking for a new provider, it can be helpful to call up your insurance provider, to go online and find out who's in network for you, who would be covered under your insurance. It can also be, helpful. You can go on ZocDoc or one of the apps that might help you find people in your area who take your insurance and things like that. So it's definitely acceptable and appropriate, and sometimes really beneficial to shop around for a provider so that you can find somebody who will work well with you. So at this time, I have to talk a little bit about COVID-19. I know some folks are probably like, oh, I know everything there is to know, and that's okay, but I have to spend a little bit of time just talking about it. We are in a time right now where, things have been looking really good, and now cases are kind of up again. And so we just want to be giving some reminders to people about the, kind of the nuts and bolts, meat and potatoes about COVID-19, just making sure that the symptoms, making sure, if you have a cough, if you have a fever, shortness of breath, trouble tasting or smelling, knowing how you can get COVID by being, in close proximity to folks who are sick, right? If somebody coughs on you or sneezes on you, or if you travel to an area where there are high case numbers, ways that you can protect yourself and protect your family. We just want to keep reminding folks, we were in a great groove and then things lighten up, and sometimes we just need to be reminded, hand washing, the importance of washing your hand and using hand sanitizer, covering up when you cough or sneeze, avoiding touching your eyes, nose, and mouth. That can be really hard for people, especially if you're out and about and when you're at the store and you're touching things and you want to rub your eye or whatever. Just want to give a reminder to folks to just be really careful about that. Just really be diligent about those practices. Especially our older adults, making sure they're avoiding folks who are sick, making sure they're, avoiding crowds and unnecessary travel, and that they have, they're not waiting until the last minute to stock up on medications or things like that, just in case. And if you think you have COVID, stay home. You might call your doctor. If you have at-home COVID tests, you might take one of those. If you haven't ordered your at-home COVID tests, you can do that at the USPS website. I definitely recommend getting them delivered to your house. It's really easy. It's very quick. And just having, those in your arsenal, just in case you need them, it gives you some peace of mind as well. But if you have questions about finding a healthcare provider or local clinics or things like that, you can call 211 or go to health.baltimorecity.gov. And then this is just some information about vaccines. So really just thinking about, how vaccines can protect us. So the vaccine comes in 2 shots, often unless you get Johnson & Johnson, and then it's 1. And then after you get your first one, you'll wait 3 to 4 weeks, and then you'll get another one. And then after 2 weeks after the second dose, then you will be considered fully protected. The COVID vaccine uses mRNA, which teaches your body how to build protection against COVID-19, but it does not change your genes. It does not affect your DNA at all. Everybody should get the vaccine, including those with health problems and older adults. If you have questions or concerns about that, definitely feel free to reach out to your doctor, give them a call and see what they recommend. But at this time, they do recommend even those with health problems and older adults do get the COVID-19 vaccine and boosters. So even if you've had COVID before, you can still get the vaccine to protect yourself and others. Thinking about social distancing and mask wearing. I know things, mandates have, expired or things like that. And so people are kind of doing what they feel safe to do, but just, keeping in consideration of when you're in really highly populated areas, if you're at a concert, if you're at a sporting event, it's still something you might want to consider wearing a mask and trying to, socially distance. Meeting folks outside when you can. The weather is getting really nice. And so we just want to be as safe as we can while still enjoying life. And so the vaccine is considered safe. There have been many trials, and the data shows that the vaccine is safe. That you might experience some mild side effects, but that is very normal, and that's your body's way of letting you know that it is building some protections. So, some folks had concerns about how fast the vaccine was produced. So this just shows, gives a little bit of context about, how scientists have been working with mRNA vaccines for over a decade, and they were able to apply that information to the COVID-19 virus. So all this extra money came in from the government, from governments all over the world, from companies and all these different things. And, so many people volunteered to participate in clinical trials, in a way that was unprecedented. And so they were able to really quickly get out vaccines for this. And so that's part of the reason why things happen so fast. But so just wanting to give some context about that. And the vaccine is completely free. Even if you go online and try to make an appointment to get a vaccine, it might ask for insurance information, but even if you don't have insurance, you can get the vaccine. And so there's more information at the Baltimore City website, coronavirus.baltimorecity.gov/COVAX. And there's more information there about, weekly testing clinics and vaccine sites and where you can go to get all of this, and even more information and more, frequently asked questions and addressing different concerns that folks may have. So I want to spend some time talking about self-care. It's really important that you make time for your well-being, for your, mental, emotional, physical, all the, for your overall well-being. And we're all, show up better in our lives and with our families and at work and wherever else when we are taking that time to care for ourselves. So improving your health and wellness. So managing your stress can help you to control your blood pressure. And there are a number of activities that can reduce your stress and improve your health. So firstly, making time for physical activity. Like I said, 30 minutes a day, or you can build your way up. You can start with 15, we'll do 15 minutes 3 times a week this week. And then next week we'll go to 4 times a week, 15 minutes, then maybe we'll go up to 20 minutes, things like that. And you can work your way up if 30 minutes feels like a lot, but the goal is to do 30 minutes per day of physical activity. It doesn't have to be in the gym. It can be going on a walk. It can be doing other exercises. It can be dancing or whatever feels good to you. Making sure that you're drinking enough water. Water can help you manage your stress. Stress can make you really dehydrated, actually. So next time you feel yourself getting overwhelmed, you feel your heart rate going up, you feel yourself getting hot and agitated, take a breath, grab a glass of water, and then get some rest. So keeping a regular sleep schedule of 7+ hours per night can help to reduce stress. So poor sleep can cause irritability and stress, and poor sleep can also cause, long-term issues like issues with heart health. So keeping a regular, consistent sleep schedule can really help you to keep a healthy heart and help you to manage your stress, manage your mood, and all of those things. So I challenge you to try one of these things today. If you have a few minutes, stop and stretch. It doesn't have to be, a whole yoga video or anything like that, but clearing your mind and releasing some tension that you might be holding in your shoulders, in your neck, in your back, wherever. So rolling your neck, bending down and touching your toes. Do what works for you. We talk a lot about even breathing in BHB, so it can help the body to focus and calm. So you might set a timer for a few minutes, 2 minutes, 5 minutes, whatever feels good, or whatever time you have. Sit comfortably in a chair with your feet on the floor. You could sit on the floor. You could sit in your bed. You could lay in your bed, whatever feels good. But, you want to breathe deeply enough to fill up your belly. And you'd inhale for 1, 2, 3, and exhale 4, 5, 6. And you'll just do that for as long as the timer says. And then moving forward, you can, even for such a short period of time, it can really help you to regulate your body, to regulate your heart, your heart rate, to feel a sense of calm and groundedness. And then get out and move. So walking or running to de-stress, to find some peace. You can get outside if you're able to, if weather permits, if you feel safe to do so. And if not, you can, walk on a treadmill, you can walk at a shopping center, you can, walk the halls at work, whatever it is that feels good to you. But definitely getting your heart rate, elevated a little bit, getting your circulation going, getting your limbs moving. That can be really, really beneficial, not only for your health, but also for your emotions and mood. So that's all I have for today. Definitely reach out to me if you have questions, if you have, questions or concerns about even COVID or the vaccine that maybe you want to talk through a little bit, or, questions, just email me. This is my email, blair.davis@ssw.umaryland.edu. And then this is our Be More for Healthy Babies Upton, Druid Heights information. If you or anybody you know is pregnant or parenting and wants some resources, wants to get involved, definitely shoot us an email or call or text the number listed here, 443-281-3729. And you can text or call, and we'd be so happy to hear from you. So I want to thank you for taking the time for yourself to think about your own health, to consider it. I hope that you make that appointment today. I hope that you make some time to get outside or to move your body today. I hope that you're thinking about nutrition, thinking about getting your fruits and vegetables and drinking water today, and that you have a really wonderful day because you are worth it and you deserve it. Thank you again and have a great one.
The boodly at the boodly Yankee Sankey, rang tang tatty. The boodly at the boodly Yankee Sankey, rang tang tatty. Oh boy, Shalimar, Swami Show. Meet the best job once more. Oh boy, I'll get you, those hep cats call.